Good afternoon. Idaho's situation with coronavirus is changing hourly. There is now a confirmed case in a new part of the state in Kootenai County in North Idaho. We're receiving confirmation this afternoon that limited community spread of coronavirus has been detected in Blaine County. That means this is the first time in Idaho that a person contracted the virus from an unknown source in their community. Up until now, all confirmed cases were the result of travel to an area outside of the state or from close contact with someone who contracted the virus through travel. At this time, it does not appear that community spread in Blaine County, is widespread. My office and members of my coronavirus working group are fully engaged with South Central Public Health District, Blaine County commissioners, and the mayors in the area to ensure a strong response is in place. Our number one priority is to slow the spread of the virus in that community and outside of it. To ensure that happens, the director of the Idaho Department of Health and Welfare will issue an isolation order for residents in the area. We are still working on the details, and the residents will still have essential services available to them, such as access to grocery stores and, of course, health care. I am firm in my commitment to making decisions in the coronavirus planning and response based on science, not fear. Every step of the way, we have made decisions based on the best information and guidance from CDC, our nation's leaders. Idaho is an expansive and geographically diverse state. Science and common sense tell us that planning and response efforts in one part of the state may not be the best approach in another part of the state. That is why I initially resisted any statewide closure of schools or other establishments. However, I do recognize that the majority of Idaho students are out of school right now based on closure decisions at the local level. My staff and I have been in regular communication with education leaders across the state in recent weeks, and I will continue to work with them in the coming days and weeks to ensure we are meeting our constitutional obligation to, quote, keep and establish and maintain a general, uniform, and thorough system of free common schools. I stress uniform because the remote delivery of education services needs to occur as uniformly as possible in every corner of the state during this time of uncertainty. Idaho has been preparing for coronavirus since January, when the first case was confirmed in the United States. Since then, we have been communicating and coordinating with schools, businesses, many players in our healthcare and emergency response chain to ensure we are asking all the right questions and opening doors to resources. I urge everyone to be even more vigilant of the preventive measures we can all take to slow the spread of coronavirus. And most of all, I continue to urge Idahoans to take care of each other. Be mindful of our actions. Find someone you can help. We will get through this together. With that, I'll take your questions. Betsy.
Governor, with the community spread in Blaine County, how many of those affected have been healthcare providers?
The question is, with the spread in Blaine County, how many have been healthcare providers? I believe the number is 2. We're aware of 2. Yes.
Governor, what exactly does this isolation order entail?
Well, it actually is similar to the advice and counsel I gave everybody yesterday, but now it's mandatory. Yes.
How many cases in Blaine County?
The total cases in Blaine County, I believe, are 16.
You mentioned that steps have been taken since January to fight coronavirus. Can you explain what some of those early steps were?
The question is what steps have been taken. We've done so many of them, I know I can't count them all off. But we have stood up. Obviously, we have 3 different task force. We have one on that's an overall task force. I was on the phone today with the president and the vice president. I'm on the phone about every second, or matter of fact, I'm supposed to be on a phone call with governors right now, and we're taking the best practices that exist in every state and implementing here. There's 3 things that are really critical to us. One is healthcare personnel, but that personnel has to have what they call PPEs, personal protection equipment. We are working through every single supply chain to make sure that's available. But very critical is daycare for healthcare workers. We're working through lots of options in that, but the most critical part of our best line of defense is first personal responsibility, distancing, good hygiene, but maintaining the quality and the trajectory of my healthcare system, and those are the 3 things. But those have been things that we started about in January, and they've just been accelerating. I have literally spent all day long in meetings talking about this issue. Betsy.
The legislature has not yet adjourned sine die. It sounds like some of the House Republicans are reluctant to sine die for fear that you might veto something and they might not have a chance to override. What is your message?
Well, the question is unrelated to the subject of the press conference, but I will tell you the Constitution gives me 5 days after delivery, and I think there's still bills coming in over here. I think part of the reason the Constitution says 10 days after sine die is the people that wrote our Constitution thought it was only fair that the governor had time to deliberate over those bills at the end of the session. Because of a variety of things, they only want to give me 5 days. I have told them that we will get to them, but today I've been tied up in this very issue, and tomorrow I'm going to be making stops at all the health districts all around the state. I think that was part of the infinite wisdom of our forefathers when they established the Constitution, to give the executive branch time to consider the legislation. Yes.
Earlier today, Boise Mayor Lauren McLean announced that bars and restaurants in the city of Boise have to close for now for dine-in service. At what point would you order that for the entire state, or would you?
Well, we're not to that point at all now, but I think if we look back at schools, I talked to all the school trustees on Sunday. I had confrontations Saturday. There was no question, because Blaine County had 2 cases at that point in time, that local government and local leaders ought to be on the front line, and to close down everything all over the state, given what's taken place in an isolated case, would be no different than when things started in the Seattle area for the president to close down the whole country. Idaho is a very diverse and expansive state, as I put in my question, and so, but this example, this order that's going to go out today is an example of when X happens, we do Y, and X was community spread. We're staying right with the CDC guidance. We're staying right with what we said yesterday, and when X happens, we do Y, and that's what this order is about. One more.
You mentioned the isolation order in Blaine County still being worked on. Is there any indication, though, so far of what that could look like, what that would entail?
Well, it would be similar to the guidance that I gave everybody yesterday prior to community spread, was that people need to stay isolated, see if they have any symptoms. It's critical over there because of the fact that there is some exposure at their healthcare facility, that we protect that. That is my obviously I want to protect every resident of Blaine County, but we have to do all we can to work with the healthcare facility to make sure that they have the tools they need. But if you're showing any kind of symptoms at all, you absolutely need to stay isolated from everybody else. And if you're showing any of those symptoms, it's not only insulate yourself, but the people that are next to you that you think would have had exposure, they need to elevate that up, and we'll be given more guidance. The reason we haven't got the final order out is this is the first one where we want to make sure we get it right. We've been in consultation with the county commissioners, with the health district, and with the mayors, and they're all on the same page.
One clarifying question for Dr. Hahn. You mentioned there was two health workers or two doctors. Could you explain what happened in Blaine County? Who's exactly confirmed cases are with?
Yeah, I can't explain it yet. We just know that late yesterday we became aware of two healthcare workers. So the investigation is in full swing today, as you can imagine. The facility is very involved, the health district and all that. So we'll hopefully have answers on that very soon, but we don't exactly know what happened yet.
And I'm assuming those two cases you do know about, are those two in quarantine right now, self-isolation, something like that?
Yes, absolutely, absolutely.
Well, thank you. The constant communication, education, citizens of Idaho is critical to us, A, limiting the spread, and B, people having confidence that, like I said, when X happens, we're going to do Y. But good behavior, good hygiene, all of those things that we've been talking about from the very first release that we put out about this issue is critical, and your assistance in helping us get that message out is very helpful for all the people in the state of Idaho. So thank you very much.
Funding for Idaho in Session is provided by the Idaho State Broadcasters Association, Union Pacific Foundation, Boise State University's School of Public Service, Idaho Cable Broadband Association, Associated Taxpayers of Idaho, Association of Idaho Cities, University of Idaho's McClure Center for Public Policy Research, with additional support from the Idaho Public Television Endowment.